Good evening, everybody. This is Mary Akehurst. I am in Minnesota with Team Catalyst. This is our Learn More series. And tonight's third Thursday session is on Pathway to a Better Health with Our Heart. And our speaker is Robin from Northern Minnesota. She is a nurse with a wealth of information. I have a resume here I'm going to look at. Robin Andreas has been in the medical field for over 20 years. Her expertise is not only in the
Oh, you know
recovery
what?
community, but
It's 46,
also
Mary.
46 years exactly. It's been a long time, even though the resume is
Mhm.
quite expansive here. So she's worked at a Healing Souls Foot Care. She's been an owner of that capacity. She has been a case manager with a PCA company. She's worked with Northern Homes Children and Family Services. She's been a patient and family advocate, a spiritual health director, hospice nurse, hospital nursing supervisor. She has
Mhm.
training and certification in medication administration, healthy teen choice school curriculum, such a variety of talents and understanding here. She's been a chairperson of Hospital Patient Family Advisory Council, Community Bone Marrow Drive, School Emergency Response Team, Community Defibrillation Program. She is or has been with associations such as the Minnesota Patient Advocate and Representation Association, the Minnesota School of Nurses, Fairview Diabetes Research Center, Hibbing Chemical Health Advisory Board, and she's volunteering in her community as well as her church. She and her husband are part of Minnesota's Lost Sheep Ministries International Ministry, where she is not only caring for people in their physical health, but in their spiritual health. And that's how I met her a
Mhm.
couple of years ago, was through a study we did with lost sheep people. And Robin and her husband were team leaders, and we tracked people taking an activator, which is a little bit what we're going to talk about tonight with her own story. So, Robin, I'll just turn it over to you if you can share your story. We're so glad to have you and your expertise with us tonight. And after she shares, then we'll turn off the recording and have some time for questions and answers.
Well, I'm really grateful to be here, Mary. So thank you for that introduction. And sometimes it makes me almost have to pinch myself to think it's been that many years that I've been a nurse and all the things that have gone on and the roles that I've been able to serve in. But during that process of growing up and realizing I wanted to become a nurse, I always knew that I cared about people and had compassion when somebody didn't feel well. And just even as a youngster, I was telling you a bit ago that I would care for my older sisters when they had, they were sick and maybe throwing up. And then as a teen, I worked as what they called a volunteer in the hospital. They called it a candy striper. And I
Mm.
wore a candy striper uniform, and we would deliver flowers and reading material to the patients and sit with them and visit and give them snacks and juice and just it really pulled me in. And so went on to become a nursing assistant and then a nurse. In 1979, I graduated. And with that, I learned how very well how to care for patients over those years, learned a lot of things and continue to learn. But oftentimes when we're caregivers, maybe even women, we forget about caring for ourselves. And so that began my journey of doing for others, but kind of neglecting myself. And as time went on, I became a mother. And with my last pregnancy, we have 5 children. I became gestationally diabetic. And I remember my doctor saying, this is a window into your future. So you remember that how you care for yourself, if you are active, physically active in your weight and all the things that you do with your dietary, um, how you eat is going to really make a difference in your future. And, really, there's so many things that we can change in our lives. The things we can't change are our age, our race, and our family history. But all the other things we can do something about. Um, so looking at that, I knew, my grandfather on my mother's side had the first, what they call an endarterectomy, um,
mm,
and he had a carotid endarterectomy, and it was written up in the journals, the medical journals. They cleaned out his carotid artery.
mm,
My grandmother and grandfather on my mom's side died very young in their 60s. I'm 67 now.
mm,
But, and my father, who doesn't know his family history or didn't know his family history, he's passed on, started in his late 40s with his first heart attack. So
mm,
all of that combined, with everything else that I was doing in my life, led me down a path um, of poor health and not feeling well and not sleeping well and finding out I was diabetic and having high cholesterol levels. I didn't smoke for many years, but I did in my 20s. And as far as alcohol use, which can be a thing that can add to things, I wasn't doing that. But a poor diet and inactivity and not managing my stress levels, depression, and that led to the diabetes and the reflux and the intestinal issues and the sleep issues and all the different things that, kind of set you up for things. And I would go for regular physicals quite often, but not often enough that I probably should have been looking at things a little closer. But at one point along the way, when I was a part of Lost Sheep Ministry, we were having a retreat where we go and we take people. It's called the Setting the Captives Free. I didn't feel well one evening, and I did bring my blood pressure cuff and my medical stuff because I take that everywhere I go. And I all of a sudden thought, oh, I just don't feel right. So I took my blood pressure and my pulse. My husband was with me, and he said, oh, I think we need to bring you to the hospital. And I felt very funny. My heart rate was really high and my blood pressure was high. And looking back now, I mean, I know now, and of course, getting to the hospital, I know once if we got there, they determined I had a heart attack. But the thing about it is I was in kind of complete denial. I wanted my husband to drive me instead of calling the ambulance. And of course, sometimes doctors and nurses or medical professionals can be the worst when it comes to being the patient. And I said, no, you're going to drive me. We made a trek 12 miles away from the camp to Sandstone Hospital, and we had a wonderful physician in this small little two-bed hospital that had an ER, and he made sure that I got the proper care and was sent down to the cities. And ironically, the thing about it is they couldn't take me in Duluth, which was the closest facility, because they didn't have enough staff in
mm,
either of the hospitals. And then the hospital I wanted to go to was Abbott, where I'd, received other medical care in the past, and they didn't have enough staff. And so
mm,
we ended up at Mercy Hospital, where I found out I had a blockage, a major blockage, 75 to 80% blockage in my, what they call the widowmaker artery. And oftentimes people don't survive that. I was able to have a stent placed, and that took care of that. I didn't have damage from my heart attack to speak of, but continued to have some issues with my heart afterwards, and what they called a sick sinus syndrome. I had a low heart rate, and I would have a real bounding heart rate. And I had, just arrhythmias and different things. Well, I ended up getting a pacemaker, but in the
mm,
process of that whole health journey, learning about myself and learning that, this was a wake-up call for me. I had started prior to the heart attack, I had started taking Protandim and was really drawn in when I found out about what it would do for me as an individual and how it could make a difference in my health. And then I suffered from COVID and I had a heart attack and then I had COVID again. So it's taken, a while for it all to, kind of the journey and it all to evolve. But I started taking better care of myself. I started sleeping better. I started eating differently. I started, looking at all the aspects of my life and how I had this second chance, and I really wanted to be around for my kids and my grandkids. I have 8 grandkids, and I didn't want to miss out. And we had had a health scare, my husband and I, a few years before that. I had aggressive breast cancer, and my husband
mm,
had had a brain tumor. And we had had the opportunity, um, really miracles happened to start our life over, but that still wasn't enough to kind of knock some sense into my head that, I really needed to change things up. And so I'm very grateful that I've been able to get off a lot of my medications. My glucose levels are good right now. My cholesterol levels are good. Everything. I'm in a metabolic clinic that I'm seen three, 3 to 4 times a year by a cardiologist, and she feels that my husband and I are the poster children for this metabolic clinic, the poster adults, I guess you could say,
mm,
just because of
mm,
how our health has changed and the difference that it's been in our, not only how we feel and look, but how our blood work looks and the
mm,
story it tells as she looks at those things.
mm,
So I can't tell you that it was always easy, and there are times, obviously, that I slip, but I learned about giving myself grace and making a plan and taking small little steps
mm,
to a better health and wellness journey
mm,
and
mm,
allowing myself that grace that, that it does take a time. Even the simplest thing is as parking your car when you're going to a store as far as you can away so you can walk farther, or taking the stairs versus taking the elevator. Um,
sure.
Getting out for a walk. And I know how important you love your walks with your dogs, and I like to
Mhm,
be out in the fresh air. And,
mhm,
those are important changes that a person can make. And, there are things that make us more susceptible to heart disease. And heart disease in women, I was telling Mary today that every year about 400,000 women in the United States die from heart disease. And a lot of our symptoms as women are undetected or undiagnosed. And oftentimes we don't always have, nor maybe a male would have symptoms that warn us ahead of time. And if we do, we're just not really even tuning into them. And I think that's probably what happened with me. It was very subtle and came
mm,
upon where I started to feel kind of winded. And I thought, well, I'm overweight. Now I have lost 65 to almost 70 pounds.
mm,
And so I was very overweight. My BMI was really high, and I was just a walking time bomb,
mm.
per se. But, all those different things, looking back, on the changes that have happened and the opportunity that if I can, share my story and one person can gain some knowledge or some encouragement or feels motivated to do the things they can to take care of themselves, then it's worth every bit of just taking this little bit of time to tell my story. And so I really,
Wow.
really do appreciate this opportunity, Mary. And um, I'm not sure if there's other things that you're thinking about. I have a number of notes here and looking back on everything, and just
Well,
I know that the spirit part of it for me is very important. The
yeah.
mind, body, and spirit, as we have discussed before.
Hmm.
Um, I can't imagine if I didn't have my faith, where
Hmm.
I'd be without that, and
Hmm.
how that's contributed to um, helping me in my journey. I know after I had my heart attack, I went through a depression, which is really common after you have a heart attack.
Hmm.
And I was on antidepressants, but I'm not on them anymore.
Hmm.
Um, and I weaned off them slowly and under the
Hmm.
doctor's care.
Hmm.
But most of my meds, I was on so many meds. If you could see the meds that I was taking and the handful of pills I had to put in my
Hmm.
mouth, and I just got maybe 4, and then I take some, like vitamins and things in the Protandim,
Hmm.
in versus 12 or 15 meds at one time.
Hmm.
And actually, after you have a heart attack, they like you to do this protocol that you stay on certain meds for a period of time because of the concern of having another thing happen, an event.
Hmm.
And but
Incredible.
yeah,
That's incredible.
mm,
Wow. Well, what I wanted to do just to add to, I mean, your testimony was incredible. So thank you for sharing. I mean, that's impactful for so many people who hear your story. So thank you so much for sharing. What I wanted to is to pull up some articles. I'm sure that you've seen these, Robin, but I'm going to pull up, share a screen here and pull up an article by the American Heart Association. I know we talked about this one before.
Oh, the mind, body, and
Yeah,
spirit. Is
just
that the
give, I'm
article?
gonna take a minute here to show the screen. Let's see. Um, let's see, where did it go? Well, it's circling. Can you still see me?
I can still see you.
Oh, okay. Interesting. It's not. Okay, here we go. All right. I'm gonna
Okay.
grab the screen right here and show it, share it. Okay. So this is, let me know when you see the screen. It should be the American Heart Association. Is, you see it? It's probably still, let's, okay, there we go. All right. So this is the American Heart Association, one of their journals, published in November of 2009. American Heart is one of institutions that have peer reviewed the protandem and the synergistic formula and back the science. So this is an article that if I had printed it out and highlighted the word protandem, I'd probably use a full marker because it's all over the place. So chronic pulmonary artery pressure elevation is insufficient to explain right heart failure. And it's an extension, it's a long article here, Robin. I'm going to go down to the summary, the very bottom, because usually you can just get the details right in the summary. But they highlight protandem quite a lot through this whole article. And then if we go way to the bottom, let's see. Now I'm going to pull this to the side so I can see it in full because this other ad is in the way. All right. Discussion. I think we're almost to the bottom of it here. Conclusions. Okay. So it says, where is it here? Um, Clinical perspective. Yeah, this is it. Um, okay, right here. Moreover, this study shows that a dietary intervention can prevent RV dysfunction and a pathological remodeling in the setting of persistent pressure overload. By inducing nuclear factor E2 related factor 2 and hemoexogenous 1, the herbal supplement or activator protandem prevented a loss of myocardial capillaries, reduced the degree of RV fibrosis, and prevented RV dilation and loss of myocardial contractilatory. So,
That's it. That's incredible. Yes.
yeah, isn't that incredible? I mean, the
Yes.
fact
And
that they
it's,
published this is also incredible.
I love to see that.
Yeah. So
Sure,
this,
it sure encourages
yes,
people to really think about it.
yeah, right. I keep this on file on my blog just so we can easily access it. The other thing I want to show everybody is, um, well, I can just backtrack right here. Also on my blog is this is I put it under activation is newsworthy. That's where I have that. I just put a whole bunch of great information here. And so that's where I kept that. And then another one is Protandem and Ohio State University. They have a study on, they appreciate Protandem in their studies. And there's a great video that they've done to describe the benefits from their perspective. And then lastly, I just want to show you right here that science video research. So here again, Protandem found to prevent a process that causes blood vessel blockage in new peer-reviewed study from the Ohio State. And so, just like we were looking at the other article, and, we can't prove or make claims, but listen to your
Yeah.
story, Robin. I mean, we don't know the
Yes,
outcome had you not started this.
I
So,
know. And
yeah,
actually my dad wasn't that much older when he than I am right now when he passed away, and he
yeah,
was headed for his fourth heart surgery. And
yep,
so my life is, I believe, the journey is going to be so much different than both my parents and my grandparents. And I don't know my dad's biological parents' history, but I
sure,
do know my dad, and he had his first heart attack when he was in his late 40s. My
yeah,
maternal grandmother was 45 when, or no, 40 when she had her first heart attack. So you
sure,
look at those statistics and you think of family history and how that affects us, and
right,
we can't change that, but we can
absolutely.
change what we're doing for ourselves. And so if we look at that and we think about, you have the opportunity to take better care of yourself, and thinking about how easily a person can start that and change that journey to another direction if
That's
they
right.
really
That's
take
right.
those first steps.
Yep, yep. And this is another great quote that Washington State says is potentially the most extraordinary therapeutic and preventative breakthrough in the history of medicine.
I
So
love that.
yeah, I like what you say. We have that opportunity, and I just feel like it's a gift to share this information with other people, friends and family. So at this point, I'm going to stop our recording. I'm going to stop the sharing first of all of this, and then I'm going to stop our recording here. And if I can find my button, um, stop